The reason why you need manual therapy, if you lack certain hip rotations or if your pelvis has shifted. Online, there are exercises and stretches to get your hip to internally rotate, to externally rotate, to the quick shotgun technique to mobilize your pelvis straight. Those are helpful. There's no denying how helpful they are. However, you will make this gain and then you will plateau. And it will be a fluctuating plateau, but you'll not continually progress because at some point you need force applied to you in order to get your structure to sit in neutral or aligned when you're at rest. So I have a mobility band pulling from this door. I don't typically have enough left hip extension. What I usually do, I can always cheat. The reason why you may not be aware if you have the mobility or motion is because you've been able to cheat. So I would just do this. It looks like I have a lot of hip extension on the left, but really I'm over sitting and rotating into my right. If I hold neutral, lean forward, like even homework I would give is if you don't have the motion, use the mobility band to help pull on the joint. And now I'm getting a good stretch here. I have weight through this leg. I'm not over cheating. Now, I could continue to do that and I will undoubtedly have gain. It's the carryover and the long term. If I don't have the band any longer and I tuck, I'm still stuck. I will make a modicum of change if I continue to do it, but I'm still stuck. However, the cheat is still there. We can just do this. I can also do this, but again, I'm cheating. I can feel that I'm over flexing into my right because I don't actually have left hip extension. To the world, it looks like I have great motion. I can do splits. Because I flex into this crease, I then start to impinge. Consequently, on this side, my internal rotation is hung up as compared to my left hip internal rotation. This is the side that I feel more pinch, even though this is restricted, where my knee has shifted and my foot and ankle is shifted. So when I do balancing exercises, on the left, it holds steady, and on the right, I have to work for a lot more control in order to go down because each joint is affected. So when people tell you flexible side, inflexible side, you have a better balancing side, you have stronger muscles on certain sides, it's not that you're built that way and that's normal. As your body starts to cheat to make motions and activities happen, certain muscles stay overactive, certain stay inhibited. Your joints affect your balance and it's going to be on one leg more than the other. That's why at some point you do need someone to actually mobilize pelvis, get the hip capsule stretched, get that fascia released to allow the motion to occur, and then mobilize each joint of your body. So instead of sitting in this rotation, unable to flex into a hip, at rest, you're aligned in neutral. So when you go to exert, you're also aligned in neutral.